Hi, my name's Lee. I work as an adult endocrine nurse specialist and I would like to talk to you about thyroid fine needle aspiration in adults. Clinical indications for thyroid fine needle aspiration. Clinical indications for thyroid fine needle aspiration are the discovery of a new thyroid nodule, an increase in size of an existing thyroid nodule, or an incidental finding of a thyroid nodule on a scan which might be non-palpable. Of these thyroid nodules, over 95% will be benign. Usually, due to the benign nature of thyroid nodules, patient referrals for fine needle aspiration do not need to be under the 2-week wait unless there is clinical suspicion of malignancy in adults such as voice changes or hoarseness that's unexplained, cervical lymphadenopathy correlating with a thyroid mass, or a painless thyroid nodule that is enlarging rapidly over a short period of time. If the patient experiences stridor due to the thyroid mass, they require urgent same-day referral. What is thyroid fine needle aspiration? Thyroid fine needle aspiration is used to assess whether a thyroid nodule is malignant. It is a less invasive procedure, is more cost-effective and carries less risk than its surgical counterpart. Thyroid fine needle aspiration can be thought of as a preoperative assessment, as the results will determine which patients need to go on to surgical intervention. For those patients whose thyroid nodule is found to be benign, it offers reassurance. Pre-thyroid fine needle aspiration workup. Before thyroid fine needle aspiration should be undertaken, the patient should have a physical examination of their neck, thyroid function tests and an ultrasound assessment. This just helps to decide whether fine needle aspiration is clinically indicated. Thyroid fine needle aspiration. Who might be involved? Health professionals involved with fine needle aspiration include ultrasonographers, endocrinologists, cytologists, pathologists, biomedical scientists, nurses, or a nurse specialist in this area. Thyroid fine needle aspiration procedure. Where? Thyroid fine needle aspirations are usually completed in an outpatient setting at a specialist centre, either in an ultrasound suite or a clinical room. Thyroid fine needle aspiration procedure. How? I'm going to discuss ultrasound-guided thyroid fine needle aspiration procedure, as this is considered by most to be the gold standard, although palpable fine needle aspiration can be carried out in those nodules that are palpable. The procedure takes about 20 minutes to complete and there is no need for the patient to fast beforehand. First, a topical anaesthesia is applied to the neck in the area the thyroid nodule is located. Although this is not mandatory, it does reduce the level of discomfort experienced by the patient during the procedure. The patient is placed in a supine position and an ultrasound is performed to visualise the nodule. Once located, the skin is cleaned with a chlorhexidine or an iodine-based skin cleanser. The patient is asked to remain very still while a small needle, between 25 and 27 gauge, is then inserted through the skin and into the nodule, guided by the ultrasound imaging. The needle is then moved back and forth for a few seconds to collect cells from the nodule. It is then removed. This is known as the Zagella technique. An alternative method is to attach a syringe to the needle to physically aspirate the thyroid nodule cells. This is also the technique used to drain thyroid cysts, although a larger gauge needle is generally required. It is worth noting that although the needle passing through the skin of the neck into the thyroid nodule sounds unpleasant, it hurts no more than a general blood test, and the topical anaesthesia helps reduce this discomfort further. However, once inserted, the patient may experience a slight pressure during the biopsy. Regarding the size of needle, the larger sizes are associated with greater risk of patient discomfort and hemorrhage. Thyroid fine needle aspiration procedure. Sample processing. The sample in the needle collected from the thyroid nodule is then either smeared directly onto glass slides and then fixed and stained, or collected in a liquid preservative. These samples are then processed and analysed by cytologists. Thyroid fine needle aspiration results. The samples obtained from the thyroid fine needle aspiration are analysed and classified using the Thy classification. There are 5 stages of Thy classification. Thy 1. This is non-diagnostic, meaning an insufficient sample was obtained. This could be due to poor sampling or preparation techniques, due to an inexperienced practitioner performing the procedure. A repeat thyroid fine needle aspiration will need doing. Thy 2. This reveals normal thyroid tissue, meaning the nodule is benign. If this correlates with the clinical and radiological findings, then there is no need to repeat the thyroid fine needle aspiration. Thy 3. This indicates follicular lesions. The patient will require a thyroid lobectomy, and if this does confirm malignancy, then they will require a total thyroidectomy. Thy 4. This is a result suspicious of malignancy, either medullary, papillary, anaplastic, or lymphoma, and requires surgical excision. Thy 5. This result confirms malignancy and requires surgical excision. Side effects. Some people undergoing thyroid fine needle aspiration experience pain at the site of the biopsy. Use of ice packs are recommended to help with this. Another side effect that can occur is hematoma. However, applying pressure at the biopsy site when the needle is removed reduces the risk of hematoma developing. Infection is not a common side effect, and the risk is reduced by observing good infection prevention techniques during the procedure and using iodine or chlorhexidine for skin preparation. The patient having a vasovagal event is a possibility. They may suddenly feel hot, clammy, lightheaded, or even faint, and occasionally, after fainting, they may have seizure-like activity. Ensuring the room is not too warm, keeping the patient in a supine position, and offering fluids usually staves off fainting. Tumour seeding can occur, although this is incredibly rare and risk is limited by the use of small gauge needles. Laryngeal nerve paralysis is again a very rare complication with a rate of 0.036%. However, this is transient and usually resolves within 4 months. Contraindications. There are a few contraindications for thyroid fine needle aspiration. These are lack of focal abnormality within the thyroid for which to biopsy, if the patient has a coagulation disorder or is on anticoagulant medication, or they are on antiplatelet medication. If safe to do so, the patient could stop the medication briefly so that the thyroid fine needle aspiration could then take place. Alternatives to thyroid fine needle aspiration. The alternative to thyroid fine needle aspiration is a surgical biopsy, but as already mentioned, this carries greater risk of complications for the patient. Patient considerations. The patient might be scared or frightened for several reasons: fear of the procedure itself or of what the results might yield. Associated feelings surrounding this for the patient are stress and anxiety. These can all be alleviated by the medical professional explaining the procedure, potential side effects, possible outcomes, and taking the time to listen to and address the patient's concerns. I hope I have guided you through the different aspects of thyroid fine needle aspiration. Thank you for having taken the time to listen.